Good evening, everybody, and I'm delighted to chair the session of today. These several sessions. It means a lot to me that we're discussing this issue, this panel survey for in 2025, because I was and on the panel discussing this in 2016, and I see Shireen smiling. It's only been a few years since then. So it's we're learning a lot, and it's wonderful. It's such an asset to have evidence-based policymaking, and if there is such a thing, a great example of that, it's the survey and the panel analysis that we get out of it, and the lessons learned. So we obviously sometimes get it right, sometimes we don't get it right, sometimes we get it wrong, and we need to understand this and the implications for the policy. That's why I'm very excited about this. So today is the second day. The first day was amazing yesterday. I attended it. Very, very informative. I took a lot of notes. And so we're going to continue with the same rules of the game, if you will. So the authors will have 10 minutes to present. The lead commentator will have 10 minutes to provide an intervention. And I will have 3 minutes to ask a question and get an answer from the lead commentator. And then there's going to be around 5 minutes of discussion. Today, unlike tomorrow, we will end it not at 6, but at 6:40 to have a bit of a broader discussion, kind of concluding discussion on what does the JLMPS 2025 tell us about women, household, refugees, and vulnerability. And the aim is to draw the connection between all of these papers that we have gone through yesterday and will go through today. So thank you again for those who just joined. The one thing I want to emphasize is because different people have things to do around 5:45, around 6, etc. We're going to try to stick to the to the timetable, and forgive me if I try to be I break in and say, okay, we're gonna have to move on. So let us start our first session 5, counting from yesterday. Session 5 is Agency in Transition, Longitudinal Evidence on Women's Empowerment in Jordan, 2010 to 2025. And the total amount, again, a long time, the amount of time is 25 minutes. So I think Yusra and Rasha were supposed to be presenting, but I understand that it's going to be Caroline Kraft presenting on behalf of the group.
Yes, I'll be presenting on behalf of the authors, and I hope to do Yusra and Rasha's work justice and appreciate their trust in letting me take this on. So I'm going to be presenting on women's agency, and it's the work they've done really is showing important gains have occurred, particularly in household voice and rejection of violence, but mobility and financial autonomy remain areas for significant constraints. So as we mentioned, we're using the Jordan Labor Market Panel survey data today. This wonderful panel has data on women's agency from 2010, 2016, and 2025. This analysis focuses on women aged 15 to 59 who asked these agency questions in all 3 waves. And agency is multidimensional. In this case, we're measuring it through 5 domains. Decision-making, which is voice and household decisions, mobility, freedom to go to key places, financial autonomy, access to money and asset ownership, gender attitudes and support for egalitarian roles, and rejecting intimate partner violence, that violence is never justified. So this is what we can compare over time. In 2025, we also started asking men some of these questions. So in 2025 only, we'll be able to compare men's and women's views on work, care, financial independence, and leadership. So you'll see that, but only for 2025. So just in terms of the motivation here, Jordan has achieved major gains in investing in women's educational attainment, but labor force participation among women remains very low. We were talking about that a lot yesterday. Women's agency can help explain the gap between education and labor market outcomes because education may increase capabilities, but agency determines whether or not women can translate those capabilities into economic opportunities. For instance, can women move freely to work, to services, and to networks? Can women participate in decisions that shape their daily life? Can women control money, assets, and their own earnings? And do household and community norms support women's work and leadership? So this is very important for translating the gains women have made into economic power. So I'll start with the conclusions, as it were, the big picture, and then I'll go through some of the details that they've provided. Um, we've seen that women's agency has improved, but unevenly across domains. In terms of decision making, there have been strong gains, high by 2025 among married women, rising among unmarried women. So that's great. Rejection of violence has also shown a great deal of progress. There's near universal rejection in 2025 of intimate partner violence. So those are two areas where we're seeing good progress. Where we're seeing mobility remaining restricted. So mobility is a very persistent constraint. Fewer than half of women can go freely to key destinations in 2025. Financial autonomy has improved, but remains very incomplete. Only half of women have access to money, and it's very rare to have asset ownership. And in terms of gender role attitudes, we're seeing mixed trends, reflecting both some progress in some areas and resistance or backlash in other areas. So we'll be digging into these as we go through the slides. So we'll start with household decision making, where we see the percentage in the figure, the percentage of women who are involved with different decisions over time. So the different colors are the different waves of the data. And we're looking at unmarried versus married women across a bunch of different decisions, which changed a bit over time what was included. So there's some differences over time, what questions were available. Now, women's voice and decision-making within households has strengthened considerably. Married women reach about 85 to 90% or more of some of the decisions in some decision domains by most of the decision domains by 2025. So married women increasingly and approaching universally are involved in these decisions. Unmarried women are less involved, but there's been progress here. Their participation in household decisions increased from 17 to 39% back in 2010 to about 53, 58% by 2025. So unmarried women are making some gains here as well. Education and age remain important stratifiers for unmarried women, where folks who are more educated or older have a little more household power. And then they're not big regional geographic differences, but the South lags in some areas in terms of women's agency. So that's in terms of household decision making. Freedom of movement is a bit of a different story. There's been some progress, but it's the most persistent constraint. So we're seeing here in the figure the percentage of women who can go alone or after informing someone to 4 key destinations without needing permission, right? So they can go themselves without needing permission, and how this has changed over time. So mobility worsened from 2010 to 2016. That actually got worse in those 2 years. And there has been improvement after 2016. So there's improvement even relative to 2010, but still fewer than half of women report free movement to key destinations, such as markets, family visits, or healthcare services. And this has real implications for employment, service access, and social participation. So freedom of movement remains a critical policy challenge. In terms of financial autonomy, we're looking at access to money, which improved, but asset ownership remains pretty limited, very similar in 2025 as it was in 2010. So the figure showing the percentage of women with access to money and owning valuables. So greater ability to access household funds we needed in 2025. And we see when we break these down in the paper and the brief, financial autonomy is strongest among older and more educated women. And it's similar for Jordanian and Syrian women. Um, Ownership of assets is pretty uncommon, particularly among refugee women. So that's an area to keep thinking about for policy. Asset ownership is important for long-term stability and bargaining power. So a key area to focus on is asset ownership. In terms of gender role attitudes, we're seeing the percentage of folks who agree or strongly agree with these different statements, like women should be allowed to work. And support for women's education is strong, but attitudes towards leadership and care roles are more contested. There's increasing support for some areas, and support becomes weaker when issues challenge traditional caregiving arrangements or leadership expectations. Support is slightly, but not vastly different, slightly higher among more educated women. So we see particularly acceptance of women's work is often conditional rather than fully egalitarian in terms of what kinds of work it takes. Now, this is a very promising story, rejection of intimate partner violence, the percentage of folks who say it's not acceptable to have intimate partner violence across both men and women in 2025, across a variety of scenarios. This domain really shows a major shift. The remaining acceptance is concentrated in a small set of circumstances, particularly those involving adultery. So normative acceptance of violence has declined substantially, and this progress really creates a strong mandate for survivor-centered services going forward. In terms of gender gaps in norms around women's work, this is a really important area. So this figure is showing for folks who are less accepting of women's work, why they oppose women working. And it's really relating to conflict with traditional gender expectations. The main reasons are primarily harming childcare or the ability to cook and clean, or that it seems like men are unable to support the household when women work. So these are very normative, male breadwinner, female homemaker roles that are creating this opposition. So this is an important area. The barrier is not only opposition to women's work, but really the conditions as well. All right, so policy directions, a couple of slides here in policy direction and conclusion. So policy interventions need to address some pretty important structural barriers. Legal reform can be helpful, but agency depends on resources, mobility, services, protection, and norms. So securing economic autonomy means expanding access to formal accounts, savings, assets, targeting low-income Jordanian and refugee women, especially in terms of assets. Reducing mobility and access barriers means investing in safe, affordable transport, especially in villages and outskirts, and bringing services closer to women. Making work compatible with care and safety. We're going to talk a lot about childcare later today, one part of the package, but you need flexible hours, transport, nearby services, child-friendly workplaces, and then strengthening survivor-centered gender-based violence systems means improving reporting and complaint processes, shelters, legal aid, health and mental health support, screening. And all of these need to be supported by shifting norms and monitoring for backlash. So working with men, particularly youth, religious leaders, media, and civil society to address provider role anxiety and care burden. So takeaway, no single intervention is sufficient. Agency requires an integrated approach. Women need resources, mobility, services, safety, and critical socially support to act on their choices. So they had some last thoughts on implementation here, which I know we're approaching time, but where to focus on younger and less educated women. Who report weaker agency, women in the middle and south regions, where mobility and autonomy lag, Syrian women and refugees for asset ownership, and men and youth are a key focus because opposition to work is rooted in care burdens and provider norms. And going forward, there are a lot of ways we can track progress through the JLMPS, the Jordan Population and Family Health Survey, and the World Value Surveys, as well as administrative data. So thank you, and I hope I did justice to the author's presentations. I look forward to the discussion.
Thank you so much, Caroline, for rich content and for also sticking to the 10-minute limit. Really appreciate that. We're going to now move to Reem Aslan, Gender Technical Specialist, Decent Work for Women Program, Regional Office for Arab States at the ILO. Reem needs no introduction to this group. So, Reem, please go ahead. Let us know
Thank
what
you.
you
Thank
do.
you, Dr. Omar, for the introduction, and thank you for ERF for this opportunity, and congratulations for the team who basically worked on the report. It's really rich in information and data. And as Dr. Omar mentioned at the beginning, it basically provides evidence for policy discussions, especially at this time. It's quite timely. We know social security law, labor law, are being discussed in the government and hopefully with the parliamentarians very soon. So we can probably, this document can also influence the decisions. Also, there is a lot of investment coming to Jordan on skills development, particularly for women. So all of this can also help us in Jordan when we plan for the future, so we can make a difference on the ground. Now, for the ILO, of course, all these issues that were mentioned in the report, from gender norms, care responsibilities, women agency, and for women economic participation are central for the decent work agenda of the ILO. You all know the ILO, so I'm not going to introduce the ILO. ILO also signed Decent Work Country Program for Jordan. It's also a key part of this work. And we are also proud to say that the Ministry of Labor in Jordan approached the ILO to work on the economic participation indicator for Jordan with all ministries that are basically playing a main role and other national institutions, which is really also shows how much there is a political will and political action taking place. I would like to leave. I'm also, like you, Caroline. I hope I will do the report justice. I have 3 messages I think that I would like to leave with you. The first one is social norms can change. They are not fixed. They are movable. So we can see that violence at at home has been improved. There is rejection, major rejection for violence at home by women and men in 2025. And if we can look in 2000, actually, that's when Jordan started the family protection department at that time. Now it's a directorate. So this basically shows how things are changing, norms are changing. And also we see that women's economic contribution is taking more and more acceptance by everybody in Jordan. But that did not happen, by luck. It happened because there was quite a bit of awareness. There was quite a bit, you mentioned education of women, that played a major role. Legislation amendments also played a major role. And community engagement do make a huge difference. And we shouldn't forget, not just the government, employers and unions, trade unions here, I'm talking about the workers' unions, but also civil society organizations that are mainly led by women. This is why we see some changes happening. So this gives us hope. This change is also positive, but still there are certain things that did not move at the same pace. So if you look, and you did mention it in the report, like if you look at the care responsibility, the unpaid care responsibility, there is a challenge there. Although we see that since 2010, at least to my knowledge, there was quite a bit of work on care responsibilities and sharing care between men and women. But still we find that changes did not happen on the ground based on the evidence in the report. So this social change is often uneven. Some norms move faster than others, but the overall message is clear. Social norms are not a destiny. They can change, and they are changing in Jordan. Not the pace of Saudi Arabia, for example, but at least it's also changing in a good pace. But still more work needs to be done. The second message, perhaps, is the most important one. The main barriers to women's employment are not morality, and they are not culture alone. They are structural, and you did mention in the report very clearly. The report shows that opposition to women's employment is driven mainly by care responsibilities. And here I want to emphasize, it's not just childcare, because we always focus in Jordan on childcare, but it's also related to elderly care, caring of a sick family member, caring for an elderly person or a person with disability. So we're not looking only on maternity leave, paternity leave, but we also need to look in the future on what we call family leave in the ILO. So safety concerns and concerns about women's reputation are mentioned only by a minority in the report. This finding changes all the conversation, which we did not have in the past. So it changes the ball game, if you wish. So the question remains, should women work? But if they want to work, then we need to have a system in place to help them work. We need to have proper transportation. We need to have proper care services in place. So these are really, really very important. So it's not a man and a women issue. Like in the past, I remember when I first started working on this, men used to say, women are competing with us on jobs, but it is no longer the case, at least in the report. That's what I understood from the report, and correct me if I'm mistaken. And basically, so again, we need to invest in affordable and quality care services. And I say care services, and I underline it like 3 lines, not just childcare. So care economy is very important. And in the ILO, we do say investing in care economy. We have a simulator. It basically speaks about Jordan. If it changes its policies, how many jobs can be created, So I'm not going to bore you with all these details. If we have the time, there is a lot to talk about. So I'm going to try to keep it short for time's sake. Of course, safe and accessible transportation is also very important. Encouraging and normalizing men's role as caregivers is also very important, because if care continues to fall on women only, then women's economic participation will continue to face structural barriers. And here, if I may suggest something for future reports, we keep forgetting the role of domestic workers. They are not mentioned in the report. So domestic workers play a major role actually in Jordan, and we do have a good number of them. Many of the women, probably in this group, they basically continued their careers because there was some domestic workers support. We should not forget the role they have in Jordan in women's economic participation. Also, I didn't see in the report households that are headed by women, meaning divorced and widowed women. Also, they also have different challenges, not just regular married women. So my third and final message is that agency requires more than positive attitude. It requires enabling conditions, decent work conditions. It's about changing systems, but if a woman may aspire to work, her family might support her to work, she still cannot have access to services. She still cannot reach her workplace. Or if she also lacks control over economic resources, then her choices will always be limited. She will not be able to work. This is why, I look at it as a mosaic. If we miss one piece of the mosaic, we will not see the full picture. Transportation matters, and we have Hazar here who worked on a transportation framework for safe transportation framework with the Ministry of Transportation and the civil society organization. It was supported by UN Women. Financial inclusion matters. Dr. Omar, you know how we worked on e-wages and how we are digitalizing the contracts for the private education sector. This will make sure that women are paid digitally. This means that there is more financial inclusion. This means that they will have a say in their income. Of course, there is always ways around the law, but still, we're going in the right direction. Hopefully, Jordan will follow to other sectors as well. Asset ownership matters, care services matter, and decent jobs close to where women live also matter. And we do have the satellite factories in the garment sector. So just to conclude with a final reflection, this report leaves us with a message of cautious optimism. We can be optimistic, but we have to be cautious. The systems are very, very important. The challenges, we identified them over and over again. We just need to act on them. Dr. Omar, before the group joined, the participants joined, you also mentioned that what's next? And I believe we do have some ideas for what is next. So for the ILO, we're happy to continue supporting our tripartite, Ministry of Labor, trade unions, JCI, Jordan Chamber of Commerce, and Jordan Chamber of Industry, Social Security Corporation, to bring women from the informal sector when they work also to the formal sector, not just to bring them to the workforce. And I will take your question, Dr. Omar, and if there are other questions from the participants, I'm happy to answer them. There is a lot to say, so I'm going to stop here.
Yes. Thank you, Reem. This is very informative. And let me just ask the question quickly with a quick answer. I don't know if we'll have time in this round for a question from the audience, but if somebody feels very strongly, do raise your hand. Now, this is a very interesting paper in the sense that it has some good news, which we don't always see, and it has bad news. So the good news is women's participation in household decision making expanded over time and reaches very, very high level. So this is one issue, sort of we're saying, okay, we're taking it off of the at least hopefully forever of our screens. And the good news also is the rejection of intimate partner violence, which became almost universal in 2025. Now, the not so good news, as you've outlined, is mobility and financial autonomy, which have sort of followed a U-shaped trajectory. And you've mentioned that family care in general is something that needs to be addressed, and I fully agree. Fully agree. A lot of time is taken by unpaid work for family care beyond childcare. So my question to you, Reem, is what policies and regulations have contributed to the good news? So you've said that social norms can change. I totally agree. But in that case, do you remember, because we've changed two things. We've changed the laws. We've made the laws tougher on violence, at least, and things like that. And there was a lot of campaigning and awareness, etc. So the first question is, what policies and regulations have contributed to the good news, and what is still needed to address the bad news related to mobility and financial autonomy? If you were to say, here's one thing we still need to do on mobility and on financial autonomy, what would they be?
So, of course, because I'm with the ILO, I will always go back to the international labor standards. So, as you mentioned, Dr. Omar, labor law and social security law for the ILO, actually, they are considered advanced. Okay, we do have some limitations. Jordan does not meet 100% what is in the international labor standards. And if I may, I'd like to focus again, because it's also a challenge, the maternity leave, paternity leave, they are there, but still they're not up to bar when we look at the labor standards. Family leave, as I mentioned, are also very important. On violence at home, actually, home-based violence, we moved forward because of the legislation. Again, we abolished Article 308, which is also very important in Jordan. That also helped quite a bit. Now, if we want to move forward, to be honest, when it comes to transportation, violence and harassment in the workplace. Actually, the ILO, they covered that under the International Labour Standard on Violence and Harassment, Convention 190. It does cover, by the way, in Convention 190, it does cover, but again, legislation in Jordan falls short on that. It does talk about world of work. So if women are working at home, actually, and they are subject, and even if they're working in a factory or a company, if they are subject to violence or harassment at home, this needs to be taken into consideration, which is something that can be covered in the labor law. So this is something that is very important. If women are harassed while they are commuting to work, from and to work, actually social security law covers it, but still it's not being covered properly in practice. As you said, Dr. Omar, sometimes we have it in the legislation, but basically providing the tools to enforce such legislation is still not in place. So I would say, for transportation, I think, especially if women are working, again, because I come from the ILO, I cannot talk beyond the labor agenda. Actually, it can be covered, under social security law and labor law to protect women from violence and harassment, even when they are commuting. And actually, in many cases, employers, government, and unions need to provide safe transportation for all, which is something, again, with the ILO, it's a tripartite. We need to hold the stick in the middle because it will benefit the economy at the end of the day, as you mentioned also in your report, Caroline. Thank you. Over to you, Dr. Omar. I hope I didn't go overboard.
No, you didn't go overboard at all. I think at the beginning we started a few minutes late. So we are about 5 minutes behind. I'm going to try to catch up with the timetable. So if those of you who have a question, please keep it in mind, and we'll have a question answer towards the end. And I'm happy to move to session 6. There's going to be speakers are Alma Bustani from Deloitte Banking Group and Marina Hisham from Cairo University. Welcome to both of you, and looking for a 10-minute sort of dive into those papers. Thank you.
Hello, everyone. Thank you so much, Dr. Omar, for the introduction. And actually, I believe that this presentation comes like a nice extension to what has been discussed in the previous one. So it's about the unequal burden of the unpaid care work and how it can constitute an obstacle to women's employment in Jordan. And it's co-authored work with Alma Bustati. So as you have mentioned today and yesterday, that a key fact is that Jordan has very low rates of female labor force participation, and this is why we are trying to see what different obstacles can lead to this very low rate, and among which, of course, is the issue of the unequal care burden and the inequalities in time use. And in fact, this unequal burden is global. So globally, women spend around 3 times more time on unpaid care work compared to men. However, this rate is higher and worse in the MENA region, ranging from 5 to 1 to 10 to 1 for women compared to men. And of course, this inequality in time use comes from the traditional gender norms following the model of the male breadwinner, female caregiver, as also it has been presented. So what are the main key takeaways from using the time use module of the JLMPS that has been introduced for the first time? So we have that 79% of women at the age of labor force participation participate daily in unpaid care work compared to only 40% of men. And in terms of time use, the daily averages, women of working age spend on average 4 hours per day compared to only 1 hour for men. And among the different factors that contribute to this unequal burden, we have 2 main factors, which are the family formation and marriage, of course. And being married increases this equal burden or this ratio between women and men to 4 to 1 hours per day. And of course, there is the issue of also the double burden when the woman is not only married, but also working or has a paid job. So in this case, she faces this issue of the double burden. So in the working paper, we have tried to see how the time use could differ between men and women based on different characteristics. And first of all, we started by the socio-demographic ones. And here you can see from the figures that we have like an echo between the age cohorts and the marital status. So at the age of marriage and family formation, we can see the stark difference between the time use between men and women, where men spend most of their time on employment-related activities, more than 5 hours daily. However, women spend around also 5 hours per day, but on the unpaid care work, leaving much less time to the employment-related activities. And as this is age range reflects, as I have said, the age of marriage, so we can see the stark difference between married men and women. And we can see that on the other hand, men would spend more time on the unpaid care work when they are divorced or widowers. And the other thing, when we tried also to see this time use averages by the different household and family dynamics, adding an extra layer of complexity to not only the marital status, but also whether woman has children or not. So basically, we can see that when the woman has young children, specifically when the youngest child is under 6 years old, we can see that this leads to an increase in the average of the daily hours spent on unpaid care work, specifically when we are talking about the direct care. So the unpaid care work, it encompasses the direct care, which means it includes a rapport of caring for someone, whether it's a child or an elderly, for example, and the indirect care, like, for example, cooking and cleaning and all of this. So having young children contributes directly in increasing the part of the direct care, and with time, when the child becomes older, this time is decreasing a little bit. The other thing we have also looked at is how this average of time use can differ when we have different households with different levels of wealth. So as you can see from this figure, that women living in wealthier households have like a small substitution effect where they decrease the time spent on the indirect care specifically, and they increase the time spent on the employment-related activities. And this can be, for example, because they use more modern appliances, for example, or something that can help them in reducing this amount of time spent on the indirect care work. On the other hand, we didn't really see a clear association between the time spent by men on either the unpaid care work or the employment-related activities in association with the level of wealth of the household. And now I will leave the floor to my colleague Alma, presenting what we have found in relation to the labor market status. Alma, please, the floor is yours.
Can you hear us, Alma?
Alma? We
I don't
cannot
see
hear you.
her. I also don't see her among the panelists. So, oh no,
She's
she is.
listed, but she has no microphone on and off nor video. So there may be technological difficulties.
Okay. She's saying, let me try again. There's a, how about this? I know this is not ideal, but should we
No.
should we turn to Hazar Asfoura, the commentator, and then see if Alma has come?
I can give you like a brief idea about the presentation until she's here. If you think this would be a good alternative.
Maybe that's a better alternative. Yes, please go ahead, Marie.
Okay. So first of all, when we started looking by the labor market status and specifically,
Sorry, I don't know if you can hear me now or no. Can you hear me now?
please, Alma,
Yes.
go ahead.
Yes, go
Perfect.
ahead, Alma,
Good.
but
I'll be very, very
we're
brief. Don't
punishing
worry.
you by making it 2.5 or 3 minutes.
I'll be very quick. So I was just saying that there are basically two clear themes in the work that I've done. The first is that married working women do more paid and unpaid work than anyone else. And whenever there is flexibility for women, what that usually means is that they do fewer hours in paid work and more hours in unpaid work.
Mm.
And you can see from the first graph that there is a double burden, and that double burden is carried by ever married employed women. So you can see that biggest line is for ever married employed women, and they work more than anybody else. If we move on to the next slide, this shows the kind of time used by the type of employment. So whenever there is flexibility, because she's a non-wage worker, it means she works less time in employment and more time in unpaid work. Although I would also point out that there is more leisure time when when she's in a non-wage work. So her total time at work is less. Next slide, please. And finally, this highlights why women tend to gravitate towards jobs in the government. And the reason behind that is that there is fewer hours spent in paid work. That again translates completely into unpaid work. So whatever time they save from being government workers as opposed to formal private workers, that goes entirely into unpaid work. Hopefully this is brief enough for my section. So the last two is just to say that whenever there is flexibility, again, it tends to mean fewer paid employment hours and more unpaid care work hours. But again, when we talk about flexibility like work from home and flexibility in terms of unpaid childcare, the total amount of hours are smaller. So it means that women tend to do a bit less work, maybe have more time for non-work activities. So that's my section. I will just move into the concluding remarks very quickly. And I think nothing that me or Marina has said today comes to a surprise for anybody. Women do more unpaid care work than men. If the woman has children or is from a lower wealth quintile, she tends to do even more unpaid work. Whenever a woman is employed, she faces the double burden. And when it comes to labor market opportunities, they tend to choose jobs that allow them to reconcile work with their quote unquote duty of unpaid family work. As such, we have a few policy recommendations. The first one ties really nicely what we've discussed in the last section around awareness for social norms, and not just for women, but I think more importantly for men, to say that actually when you have, care work should be shared between the genders. And the other two are family-friendly workplace policies and accessible care services. For women at work, this might mean that they get to engage more in non-work activities. And for women not at work, it might encourage them to take up employment. So this is my very brief presentation, and I'll hand it back to you.
Thank you, Alma. Thank you for really a very good use of the few minutes we gave you. Now, let's turn to the commentator, Azar Asfoura, Women's Economic Empowerment Portfolio Lead at the UN Women in Jordan. Azar, the floor is yours.
Thank you, Dr. Omar. And first, I would like to start with thanking and congratulating ERF and all the authors on rolling out the first time use module in Jordan. We have been trying for a long time as UN Women with our partners in Jordan to do it, because as everyone shared before, evidence-based policy are very important. Social norms play a critical part in determining women labor force participation, and in addition, of course, to all of areas of her life, of course. And therefore, I would start with the first point about the value of this paper and how important it is. Of course, as the colleagues and authors concluded with, there is nothing new in what they shared, but they quantified and they provided the empirical evidence that we can use and go, because we have been working for a long time, everyone in this field trying to advocate to address this issue and policy and programmatic with the private sector, of course with the government, and therefore this is a very valuable start, and we are very happy to work with ERF and the authors on this. In addition, as UN Women, in addition to that, we are hopefully very soon next year, we're going to start or roll out a full-fledged time use survey, a national time use survey in Jordan. So this is a very important start for us that we're going to use. My second point is the time use data is essential for policy design. Whether in, especially I will focus on my area of work, especially when it comes to women's economic empowerment, the double burden, the accessibility and affordability of childcare services that would address this part, in addition to the elderly care, which is becoming, as well as Reem mentioned, is equally important, because across the range of care, unpaid care responsibilities, it's always considered as women's responsibility or sole responsibility, unfortunately. And that would take me to the next point, that unpaid care is not only a gender equality issue, it is inclusive growth issue. And therefore, using or the time use survey, its results and recommendation, etc., it highlights the time poverty that women face here in Jordan, of course, as in other areas in the region and around the globe. But it is stark here, and as well, this is not only the first time that we know that. UN Women produced different reports that as well reiterate this, and even the subject or the issue is more critical in time of crisis, especially, for example, we did a study during the COVID, the pandemic, and because women staying at home, taking care of people who got the COVID, in addition to the usual care, unpaid care responsibility, the number of unpaid care hours, in addition to the paid care, care or the paid jobs, it was a very long number of hours that make it unsustainable for women to maintain, and therefore it is very critical for us to have these results. The unpaid care work as well for in the paper moves from the discussion beyond skills and jobs, because usually and I'm a very strong advocate that of course social norms, structural challenges are very important determinant on women's economic participation, but as well the economic situation, the availability of jobs play another important and critical role. But in addition, this paper help us as well to shed the light on the double burden, how it is across or all over the life cycle for women in different ages, in different socioeconomic status, whether you are working or not working women, and therefore it is a very deeply rooted, unfortunately, gender stereotype in our community and our culture that we need to address. Of course, I think everyone with us today, we always start whenever we start working or drafting something about women's economic participation, how low it is, and the paradox, especially when Jordan as well achieves a high education outcomes for women, and that is why. But at the same time, it doesn't link how it is very low labor force participation. So of course, this is an area that needed more result and more evidence. I just don't want to go over time. I have 1.5 minutes. The remaining points I want to address here about family-friendly policies. Of course, as we all know here in Jordan, in the last, I think, 5 years, and of course, Reem been very involved in this area about the reforms and policies and laws and the progress that we achieved as a country when it comes to that area. But the enforcement, as she said, still constitute a considerable constraint. And that as well apply. For example, we have the bylaw of flexible work arrangement. It has been implemented, but we still didn't see the impact yet on female labor force participation. The Riaya program, for example, and what it provides, still, for example, women generally, or according to the numbers, the vast majority of women they chooses the option of the cash, even though the 25 JDs, which is far less than, for example, the contribution to the childcare services fee, which is up to 60 JDs, and that's again because of the stereotype of the availability of childcare services doesn't mean always that parents will choose it, because
I'm gonna need to intervene. Can you wrap up within the
yes,
next?
yes. Just this is my final point. It's all about as well quality, accessibility, transportation, and therefore it's multi-layered, situation. But it is this model provides us with the evidence that we needed. And of course, as Reem said, there are a lot of points that we can discuss. But happy to share more during Q&A. Over to you.
Okay, great. Thank you, Hazar. This is, as you said, it's multi-layered and it's so complex, but it doesn't mean as we all agree, we have to do we have to work on the different dimensions of it. The one very interesting aspect of this paper, and I've learned a lot from these papers, is the issue of social stereotyping and masculinity and how that's socially defined, etc. And I really like this idea that let's emphasize shared duties rather than splitting tasks. Splitting tasks in different sort of that the paper suggests that international experience suggests doing that. And also there is what different policy stuff that I've read focus on flexible work arrangements. But I've also seen material that says flexible work arrangements sometimes apply only to women. And if it applies only that might actually have the reverse effect and will work in the opposite direction. So, what do you think? First, are there great examples about changing the culture of towards sharing, thinking of shared duties? Are there good examples? I don't know. In the region, is Turkey, is Saudi Arabia, I don't know if Egypt has done anything on this, any of the North Africa countries. And the second one is, would you agree that it can be counterproductive to do flexible work that applies only to women jobs?
Thank you, Dr. Omar. Very quickly, because I know I only have 3 minutes. So to answer your first question about shared responsibility and changing the narrative from helping women to shared responsibility because it's a family responsibility. Of course, yes. And in Jordan, we have been working as well in the region, let's say as UN Women. We have been working, this is the third phase of Dare to Care or addressing harmful masculinity practices, let's say, when it comes to the understanding of unpaid care work. The first phase was about data collection, and we have, report. Jordan was part of that. But because, again, the culture, harmful social norms, and the acceptance, but now we are working on the third phase as well with the using the ecological model, working on a policy level, working on institutional level, and community level. And currently we are piloting a program here in Jordan on how to promote shared responsibility between both parents and even the children, boys and girls, when it comes to the task or chores, the household chores. So yes, there is. And unfortunately, we don't have time to share more, but I'm happy to share with everyone who is interested and link to my colleague Sanad, who is working closely on this because he's the project manager. To answer your second question, according to of course, the bylaw, there's no difference. It is available for both men and women. But of course, there's the difference between policy and practice. Unfortunately, yet, it's not only in the community, the culture and norms, but as well, normally it reflects it is reflected into the institutional policies in the private sector and as well in the government. It's expected who's going to take flexible work hours or contracts is going to be, women, not men. So it's frowned upon in many cases. And therefore, we're working using our women empowerment principles, working with our network of more than 270 signatories of enterprises in the private sector, promoting how we should address this disaggregation and gap and to provide it equally for both men and women without affecting their promotion and their accessing opportunities.
Okay, great. Thank you very much. By the way, I was just thinking, I have a small comment. In the meantime, anybody who has a pressing question on any of the sessions so far, please raise your hand. But Hazar, as you were talking, it reminded me of what I've seen in terms of the Ministry of Education curriculum. And I have seen changes in the curriculum about the stereotyping of roles of men and women. And for me, it was very interesting, and I really enjoyed. And I called them and thanked them for working on that. Obviously, the curriculum needs constant tweaking and adjustment, but that's one thing that maybe in a panel or something like that over the next 20 years we can check with children who's been exposed to this curriculum versus previous curricula that tended to show women in the kitchen and men sitting in the living room watching
You are
TV.
absolutely right. And that's why the GLMS is very important, because it's a regular, and hopefully we're gonna get, another one in after less than 8 years now, I think, therefore, no, 10. It was the last time 2016. And therefore it's very important to monitor the change. Of course, that should start from a young age.
Great. Thank you very, very much, Hazar. I don't see any raised hands, and it is 4:55, which means we have 5 minutes for a break, not 10 minutes for a break. So it's not a coffee break per se, it's a bathroom break. And let's meet at 5 sharp. All right, everybody. Can we reconvene? All right, so we're starting with session 7. How can Jordan increase female labor force participation? That is the ultimate question we're all concerned with. And as speakers, we have Caroline Kraft and Ragi Asad. Caroline is with the University of Minnesota. Ragi Asad, we all know, is the one who started all of this mess. University of Minnesota. Paloma Avedano, University of Minnesota, and Rutongi Lee, University of Minnesota. You have 10 minutes, and then we're going to move to commentator Shireen Abadi, Senior Consultant at the World Bank. Go ahead.
Great. Give me 1 second. Okay. Well, good afternoon. Today I'll be presenting how can Jordan increase female labor force participation in Jordan. I'll be sharing findings from a recent policy brief, which examines how Jordan's childcare and maternity leave policies are or aren't helping women enter the labor market and what needs to change. This is joint work with Ragi Assad, Caroline Kraft, and Rutong Lee. So Jordan's female labor force participation rate sits at just 15% as of 2025, and it is one of the lowest in the world. And it hasn't been rising despite substantial increases in women's educational attainment. Now, the picture gets starker when we focus on mothers. Basically, among women with children aged 3 to 5, only 8% are actually employed. And this is not for lack of policy effort. Jordan has maternity leave, social insurance, workplace nursery mandates, and a kindergarten expansion. Yet participation for women in the labor force remains stagnant. And this policy brief essentially asks why and what it would take to actually move the needle to get more women into the labor force. So for context, in low and middle income countries broadly, ECCE provision has actually had positive effects on maternal employment. In about 21 out of 22 rigorous studies, the one null result, as of this paper from Halim et al. 2023, documented, came from the lowest baseline participation setting in the sample. So in this case, MENA is an exception to this. And studies from across the region, the MENA region, including our own work in Jordan, which part of this brief is based on, find no impact or even negative impact when days of care are short. And Jordan is not an outlier. It is part of a regional pattern, and understanding that pattern is what this policy brief is actually about. So Overall, public sector workers receive about 13 weeks of fully paid maternity leave. Now, in the private sector, before 2010, employers were legally required to pay for maternity leave out of pocket, which created a direct incentive not to hire or retain women of childbearing age. Now, in 2010, that cost was shifted to the Social Security Corporation, with employers contributing to about 0.75% of payroll. And this is what we would consider a well-designed reform, right? And furthermore, women also have access to unpaid nursing leave. So 1 year in the private sector and 2 years if you work in the public sector. And this sounds very generous on paper, but the next slide is going to show what actually happens in practice when it comes to take. So after the 2010 reform, the share of private sector women receiving 70 or more days of leave increased, but only from 25% to 31%. Meanwhile, the share receiving less than the legally mandated minimum actually increased from 28% to 47%. Now, unpaid nursing leave uptake in the private sector declined, with women taking no leave at all, rising from 43% to 53%. And the reform reduced employer costs, but did not produce consistent or reliable access to leave, unfortunately. So this means that implementation is uneven, and many private sector workers remain unprotected. So on childcare, Jordan has made 3 big moves. So the 2019 workplace nursery mandate was updated to cover any employer whose workers collectively have 15 or more children under 5, regardless of sex, a more gender-neutral design. And in 2021, the Riaja program was launched, which offered insured mothers earning under 1,000 JD per month, either 25 JD per month for home caregiving or 60 JD toward nursery fees for up to 6 months, right? And KG2 has also been expanding. So it has been reaching 65% enrollment as of 2025, which is up from 57% in 2018, but it's still short of the universal coverage target that the Jordanian government is aiming for. And so now this chart is telling us what's really happening when it comes to ECC coverage, right? So ECC enrollment for children 3 and younger is essentially negligible. It's around 1 to 4%, and it reaches 18% for 4-year-olds and 58% at age 5. And so near universal enrollment only kicks in at primary school age, and fewer than 1% of children under 6 were receiving Riaja assistance. So formal childcare before the age of 5 remains extremely limited in reach, as you can see from this graph. So now, using the 2025 Jordan Labor Market Panel Survey, our research finds no detectable effects of ECCE availability on the employment of mothers with children aged 4 to 6. Access to childcare alone is insufficient in a context where Jordan's baseline employment rate is this low. So something else is binding, right? And this also kind of matches what the Halim et al. Paper showed, that out of 22 studies, the one study that didn't find the significant results also had low baseline employment. So it seems that it has something to do with that. Okay. So there are 2 sets of barriers that may be explaining why. So on the demand side, we see that gender norms remain deeply conditional, right? So support for women's employment drops to 39% when work involves mostly male workplaces, and to just 31% when women must return home after 5 p.m. And likewise, 63% of the respondents agreed that men's jobs should be prioritized when jobs are scarce. So you already see a preference for the type of job for who should be having a job when there's a scarcity of jobs. And we also found that there is a low acceptance of non-family childcare, and this is particularly interesting. So even among women, only 63% find a childcare facility acceptable, compared to 75% for care by an adult family member. So there's already this disparity between the types of childcare that people find acceptable, right? Or that they have a preference for. And now on the supply side, we see that most ECC programs run only 4 to 5 hours, which approximately ends around noon. And this doesn't align with the reality of the average Jordanian workday, which is nearly 9 hours. So childcare that ends at noon is not going to enable full day employment for women that are responsible for taking care of their children. So there are 5 main takeaways from this policy brief. First, maternity leave enforcement must be strengthened, and the 13-week duration should be standardized across public and private sectors. The implementation gaps we just saw make this urgent, right? There is this big gap in terms of how many weeks you get if you're in the public versus private sector. Private sector gets 10 weeks, public sector gets 13 weeks. It'd be easier if that gap was closed. And second, we see that very few women can actually benefit from employer nursery mandates as currently implemented. So the number of employers that are actually meeting these nursery mandates is very low. So there's a lot of work to do there to make sure that employers are actually offering the services that they're meant to be offering for women. Third, ECC access for children under 5 remains far too limited, as we saw in the graph. The enrollment in ECC starts taking up around age 5 and then becomes near universal for the primary school age. But before that, it's fairly negligible. And fourth, childcare programs must be redesigned around labor market realities, right? So full day and affordable care for children under 5 is essential. Because as we saw, if a daily ECC it only covers around 4 to 5 hours and women need to work approximately 9 hours, then that's not really meeting the realities of the labor market that women exist in. And fifth, gender norms and low trust in formal childcare must be addressed, perhaps through community engagement and quality improvements. And so one potential avenue here could be high quality home-based childcare, which may better balance affordability with the quality needed to build trust, right? Because we saw that there was this, it seems to be preference for family-based childcare rather than outsider-based childcare. But perhaps if childcare is done at a setting like a home-based setting and it's more affordable, then this could build some trust that is needed so that the preferences aren't so strong for family-based childcare. And alongside this, complementary labor market policies like flexible and part-time work arrangements are needed so that it can meet the realities of women. And so the bottom line here is Jordan's existing policies, as designed and implemented, are unlikely to substantially raise female labor force participation on their own. But if you take these 5 criteria that we just mentioned, it is possible that working together, they might be able to actually increase women's labor force participation. So yeah, that's what the policy brief is about. So thank you.
Paloma, thank you so much. This is a wake-up call. In a sense, it's to me, this issue is one of the I have to say it's very disappointing because and as you say, in 2010 we changed we introduced maternity insurance, maternity periods. In 2019 we've done all sorts of things about expansion of childcare facilities and putting Social Security to subsidize costs, etc. Yet we see these results. So my question is, oh, I'm sorry. This is Shireen's slot now. I'm awfully sorry. Let me just finish my question and we'll write it down and then we'll move to Shireen. I guess it's just because I'm anxious about this. So first question is employer mandates to provide childcare. You say it's not very few women are taking advantage of it. So the question is, what's the next step? Is it about enforcement? Is it about awareness? Is it about what? So that we can try to tackle this. And the second one is on access to early childhood and the biases about household relatives, leaving kids with relatives versus outdoor, some independent childcare centers. And indeed, there is a lot of mistrust because historically, a lot of these would entail just putting children in front of the TV screen for 8 hours a day. So again, here, how can we make enforcement? Is it enforcement or is it something else to bridge confidence in this area? And Shireen, again, sincere apologies. I turn it to you.
Thank you, Dr. Omar. So before, there are a few items that I was not planning to talk about, but given that given the presentation and your remarks, I will start with these. First, on the SSC coverage, I'd like to maybe later for the authors to help me understand whether the analysis of the maternity leave duration have taken into account those enrolled in SSC compared to those that are not enrolled in SSC, because my understanding is that the diagram pulled in all of the private sector workers, regardless of coverage, into one diagram. So this might be an important distinction to see if those that are enrolled in SSC are getting the full leave compared to those that are not. Just a quick remark. On the element that you asked about, Dr. Umar, which is employer-provided childcare, my 2 cents, this is not the solution. The real solution is universal childcare services. You need to make sure that the service is available for all. And I would like to say to the authors, thank you very much for the great effort. I've received the policy brief from 6 or 7 different people before, when it was originally published, with a lot of exclamation marks and some having really, unfortunately, insufficient understanding of the empirical evidence and the findings. And as such, I'd like to focus on this very, very quickly. First, the use of fuzzy regression discontinuity design is great. It is appropriate and credible for the early childhood care and education question, and it follows the question that you want answered. Does this access increases enrollment and as such increases employment of mothers? So this design, and I have to go into the methodological aspects because of this misinterpretation. This design is suited to estimating local short-run effects of eligibility-induced early childcare and education enrollment. And the paper is careful about the interpretation and the scope of this analysis. Thus, the paper does not generate. It says we do not have a detectable short-term increase in maternal employment in Jordan, but it does not rule out employment effects from broader childcare reforms, longer hours, higher quality care, after school care provision, complementary labor demand, and flexible work policies. Thus, this moved me to the second point, which is the critical message conveyed by the paper. The message that I captured is that the evidence shows that childcare policies are relevant. Okay, it shows that Jordan's current childcare model is not sufficiently intensive or aligned with labor market conditions to shift maternal employment. So this is very, very critical to all, what I conveyed to all the people who shared that with me with exclamation marks. So childcare reform therefore needs to move beyond expanding seats alone to building a full-day, affordable, high-quality care system, while also addressing job flexibility, labor demand, gender norms that shape both household decisions and employment behaviors. This brings me to a third point, which is the barriers that limit policy impact. And I'm not going to go through them, but the team have identified many. I was able to capture eight critical areas that limit the policy impact, and each of these barriers merit further examination and could help inform the design of future interventions, such as the short service duration, the broader labor market constraints, etc. So finally, I would like to connect this excellent work, the policy brief, the research paper, to the wider and the broader research that ERF is doing with this JLMPS survey. First thing, I would like to question us all about the limited acceptance of formal childcare that we usually report on. It's an issue that the World Bank have examined through both qualitative and quantitative research. And my question for all of us is how we should interpret the stated preference for kin-based care over formal childcare in a context where supply itself is limited. Are we asking parents to express preference between options when one of these options may not even be available in their area? And the research that I led for the World Bank, similar to what you find, there are parents who want to enroll their children in formal childcare, but they have limitations in terms of availability, affordability, and quality. This is the first question I would like us all to think about. The second area, which is the broader labor market constraints beyond childcare, and I don't want to talk about flexibility of employment because I don't think that flexibility is the solution. That what we really need to make sure is that the labor market allows both parents to accommodate employment and care responsibility. And I want to encourage everybody to look at the employment structure paper by Dr. Raghi and Dr. Lina, the paper on the wage equity and the real wage growth in Jordan over time, the school to work transition. All of this body of research is extremely critical to understand the demand aspect and the working conditions in the private sector in Jordan. On the positive side, we've seen formality gains. However, there are several important opportunities for further progress. Around half of the workers are still informal. Many lack leave benefits. Long working hours remain common. About half of employed men, this is analysis I did on the side, half of the employed men work 6-day weeks rather than 5-day weeks. So these conditions matter directly for women's employment and for the ability of families to reconcile paid work and care responsibilities. So I would leave with the work of the Nobel laureate Claudia Golden. She argues that the challenge is not only whether both parents work, but whether labor markets allow both parents to combine meaningful career with shared caregiving. As long as high-paying jobs reward long, inflexible, and unpredictable hours, what she calls greedy jobs, couples often specialize. They make a choice, an informed choice, right? That one parent prioritizes paid work and the other absorbing the care responsibilities. So in practice, this caregiving role falls on women, and thereby it's the labor market that is reproducing gender gaps in employment and in earnings. Thank you, ERF and the Department of Statistics for your significant contribution to this topic. And I'm really glad that I ended up intervening, providing remarks on this research that I received so many times over the past few months with exclamation marks. Over to you, Dr.
Shireen, as always, thank you very much. Amazing comments. And we actually have a few minutes, and I'm going to take them to see, please, if anybody has other comments, questions, etc., please raise your hand and let us know.
Yes, so we have a few questions in the chat.
Oh, okay. I'm not seeing that. Please read them.
So Ghada is talking about I'm not going to be very specific here, but she's talking about the policies that are increasing the care burden on families. This is a very interesting perspective on the policy that you just mentioned, and I think it is maybe the authors might not be very aware of this policy in Jordan, but their work is very critical to help us assess what would be the effect of these policies on household before implementing them. So a very interesting question, and I think ERF and others can help the government answer these critical questions when they come. Southern question was answered by Caroline already, and the presentations. The question on presentations was also answered by ERF. Over to you, Dr. Omar.
Okay, thank you. All right, I think this is great time to move to our session 8, shocks and coping for Jordanians and refugees. So we're kind of switching now to issue of refugees and shocks, how Jordanians and refugees deal with them. We have Baiza Golmez Oglu, London School of Economics, and Sarah Winton, London School of Economics. Welcome on board, and 10 minutes, please.
Thank you so much, Dr. Ghazaz. I don't think Beza was actually able to join in the end, so I'll be doing the presentation on behalf of both of us.
Okay.
Am I supposed to share my screen directly, or are we doing
Yes.
it? Okay, perfect. 1 second. Just closed it out. Okay. All right. I guess that did not work. View presenter view. Sorry about that. Oh no. You shouldn't be allowed to do technology outside of LaTeX. I've apologized. It's been a while since I've used PowerPoint.
You're good now. Just get rid of those Zoom.
Okay.
Perfect.
Sorry so much about that. So I want to share our work on shocks and constrained coping in Jordan. This is really exciting because it's a new module in the 2025 iteration of the Jordan Labor Market Panel Survey. So we're going to get a little bit better understanding of the shocks that both Jordanians and Syrian refugees face and how they are able to cope with them. So I think the key findings that we want to impart, if you take nothing else from this presentation, is that first of all, shocks are extremely widespread in Jordan. So at least 1/3 of Jordanian households have experienced one shock or more in the past year. This is, of course, even higher for Syrian refugees outside of camps. They stand at 53% having experienced a shock in the last year, and even higher among camp-based Syrians, which is at 60%. The second thing is that this corresponds to quite a bit of food insecurity. Food insecurity, of course, maybe not of course, but affects Jordanians at a lower rate. So 12% report food insecurity, but this is much more prevalent among Syrian households, with 37% out of camp experiencing food insecurity and 48% within camp. And when we say food insecurity, this includes everything from just skipping a meal a day to going entire days without eating. And we'll get into kind of the levels of insecurity later. So shocks are widespread. Food insecurity is a problem. How are households coping with these issues? So I think the main thing to take away is that food insecurity, while it's has baseline levels of prevalence, it's also going to be something that's affected by shocks. So households, when they're hit with a shock, and so these shocks are things like economic shocks, like you lose your job, environmental shocks like drought, and health shocks, like someone in the household gets sick. Households are going to compensate by reducing their food consumption primarily, and also cutting health and education expenditure. And then another way of coping that comes up commonly is borrowing informally. And I think this raises in a point about formal credit access, which Syrian households have virtually no access to. And I think the final thing is to think about how policymakers, both the government and the humanitarian sector, can respond and help insulate households from these shocks. And we just want to point out that it's a very fragmented assistance landscape. So Syrian households are almost entirely dependent on UN agencies for support, Jordanians on government programs. And so there's this kind of duality that might have some inefficiencies that we'll talk about later. Okay, so what are the shock exposures by population group? In a very correlated regression, we find that the strongest predictor of whether or not you've had a shock is actually controlling for observables like employment, education, and other demographic characteristics is actually being your nationality. So being a Syrian makes you 20% more likely to be vulnerable or have a shock. And so, here are just the raw means. So, Jordanians, about 33% have had a shock in the past year. And you can see the numbers for Syrians in and out of camps. And I think, this corresponds to an economic disadvantage. So 77% of Syrian households fall in the bottom two wealth quintiles in Jordan. And this is only, 30% of all Jordanians. And I think the other point to make is that this is, of course, compounded by being in the camp. So this is a common insight from this chapter, which is that basically Syrian refugees are more vulnerable. Syrian refugees out of camps are more vulnerable than Jordanians, and Syrians in camps are even more vulnerable than Syrians out of camps. And so 99.7% fall in the poorest quintile. So then we want to think about this kind of food insecurity and its role, its prevalence with and without shocks. And so I think what you can take from this graph, where the red bars are going to be, and when a household experiences shock, is for all the groups, having a shock is going to increase your food insecurity. But the baseline levels and the response rate are, of course, very different. So Jordanians have a low level of food insecurity for those who don't have a shock. It's only 3%. Remember, the average across the two groups is roughly 12%. But it jumps up almost 10 times to 29% if they are experiencing a shock. Comparatively, Syrians out of camp start at a higher level. They start at 12%, but they also see a very high increase to nearly 5 times to 56%. I think most stark is the Syrians in camp, which have a very high level of food insecurity even without experiencing a shock. And so once they are hit with a shock, it doesn't have the same sort of adjustment margin that you see among Jordanians and Syrians out of camp. Okay, so unfortunately, we know that shocks are prevalent and shocks, trigger more food insecurity. How are households trying to cope with this beyond just eating less? So, at the bottom of this graph, you can see that when hit with a shock, Syrians are much more likely to eat less, which is consistent with the previous chart I've shown you, about twice as more likely than Jordanians. But there's also a variety of other strategies that Jordanians and Syrians are employing. So, I think kind of going from most common, which is at the bottom, to least, there's also a lot of borrowing informally. Of course, this is more prevalent among Syrians than Jordanians, but it's still a common approach. I think most interestingly, many Jordanians, about 50% of those who have received a shock, say that they did nothing. And given that the survey also asks for other coping strategies, we have to think that we're not sure. We don't want to overinterpret this, but it's suggestive that either they've run out of options, or they don't feel like they need to make a major adjustment to weather the shock. I think it's something in future waves to really dig into to understand, if it's just a perceived, we weathered the shock, we did nothing, but maybe there were smaller changes that were made that they're just not registering at the household level. And then, of course, I think importantly, there's a lot of cutting in health expenditure among Syrians. That's more common than Jordanians, but Jordanians are more likely to cut education expenditure relative to Syrians. So about 9% of Jordanians report cutting spending on education, and only 7% of Syrians. And then, of course, you can see the other, like sell assets, is again more common among Jordanians because they have more wealth to begin with. So it seems like there's quite a lot of variety in the types of coping strategies, but all of them have kind of this hallmark of generally sacrificing immediate well-being and long-term human capital investment. So thinking about cutting food and expenditures today, and some things that maybe don't feel as biting today, which is like education or health, but may have really important impacts down the line. Okay, and the last point again I want to think about is how assistance is structured to support all of these households that are experiencing shocks and are clearly running out of coping strategies to employ themselves. So Jordanian households, 28% receive assistance. This is going to come primarily from government programs, such as the cash transfers that the government provides to low-income houses, pensions, Ministry of Finance grants, and very few receive UN assistance. Comparatively, Syrian households ex ante receive more in aid, so like 51% have any form of assistance, but it's coming from a totally different source. So it's coming from UN agencies, UNHCR, WFP, UNICEF, and not from the Jordanian government. And then, of course, most starkly, Syrian households in camp, kind of in feature of being in the camp, are going to be even more reliant on assistance. And so what does this all mean, kind of taking stock, and what should we do with all these facts? I think we kind of identify 4 key areas of policy priorities. I think the first is going to be shock responsive cash assistance. So this is the idea that, when households are hit with a shock, they're going to need to, cash transfers at an adequate level that they can then use to weather the shock. And so thinking about funding that can be structured around shocks and sufficiently continuous to help smooth these shocks is going to be what we think is a priority. The second is, of course, this structural inequality between Syrian refugees and Jordanians that leads to a higher prevalence of shock and a higher reliance on really negative coping strategies such as eating less that is more prevalent among Syrians. And so I think I have a job market paper that I look at evaluating the impacts of the Jordan Compact on both Jordanians and Syrians, and not to, that's a kind of separate work, although I think it's very relevant to this. But I think what I found is it's very impactful for Syrians. And so, really thinking about how to reduce a lot of the barriers that were initially alleviated by the work permit scheme in 2016 have kind of been put back in place. So with the fees and costly social security contributions tied to these work permits. And so I think, given the value add that these have for the refugees and the evidence that it doesn't seem to negatively affect Jordanian workers particularly, and actually has an upgrading effect among the poorest Jordanians and low skill sectors. There's a lot of returns to reducing these barriers to refugees' work so that they're less reliant on some of these cash assistance and foreign assistance systems and can kind of graduate out of poverty. The third point is going to be integrative assistance systems. I mean, thinking about, as we think long-term, how to incorporate refugees who decide to stay and don't return to Syria following the fall of the regime. How can we incorporate them into national social security, or at least improve coordination between the UN and government programs so that they're not kind of doubling up on efforts in terms of bureaucratic costs and all the machinery that it takes to target and provide assistance. And I think the fourth, which speaks to the JLMPS at its core, is thinking more about data. So right now, as I said, this was a hallmark section of the JLMPS, in that we didn't have this data before. And so we only have a cross section to think about experiencing shocks. And I think collecting longitudinal data to really understand how households weather shocks and how they recover and what that recovery period looks like is going to be really essential for creating evidence-based policy that's most successful. So I think having more data to be able to say how shocks, the dynamics between shocks, coping strategies, and recovery is going to be really crucial going forward.
Thank you.
Yes.
Thank you very much,
just a
Sarah.
conclusion.
Thank you. This was great. And invite now Margaret Duponchel for commenting on the paper.
Hi, good afternoon. Thank you, Your Excellency. And I'll start by congratulating the authors for a really nice paper and a really good presentation, Sarah. So I'll start with some common general observation, and then I'll move a little bit deeper into the paper itself. And then I will comment on some of the policy implications that you mentioned. Sarah. And maybe just to introduce myself, I'm Margarita. I'm the Senior Development Officer for UNHCR Jordan. So first of all, I think it's very extremely, in fact, valuable to have a data that enables meaningful comparisons between Jordanians and Syrians. And the JLMPS is really best practice in that regard in Jordan. So it goes towards, it's a great step towards greater data inclusion that is definitely needed. It allows us to benchmark assistance and outcomes across population. The panel is also enables to track over time. This is great, despite the limitation that you acknowledge in the papers, in the paper. So I think one main observation is that this is great to be able to also understand that Jordanians do face significant vulnerabilities and have to cope with shocks in, frankly, a very similar way as the refugee populations. In terms of the results, I mean, they are dire results. They're not, they don't come so much as a, you know, it is something to be expected in light of the very difficult economic situation in Jordan that doesn't spare refugees. One thing I wanted to mention is that it will be useful to look at return dynamics and to put this, you know, complete shift in the refugee response, and in fact in the context in Jordan, in light in your paper. So if I understand correctly, the JLMPS was collected at the beginning of 2025. Q1, Q2, by the end, just to put it in perspective, by the end of August 2025, already 150,000 Syrian refugees registered with us at UNHCR had returned. And this might be good to look into this data in order to explain some of the difference that you observe between the survey waves, being the share of refugees residing in camps, being female-headed households, where we see an increase in female-headed households. We know that households tend to split as in the return movement, with one adult in the household going ahead with moving to Syria in order to prepare the ground. So there may be some explanations there linked to return. One question I have throughout your analysis is, when you look at non-camp population, when you do the disaggregation, do you have representativeness into these subgroups? And if anything, it would be nice to clarify this, and at least with a footnote, and to mention the limitations if this is not the case. I would also invite you to look at the VAF 2026 data and compare. It has a larger sample. It remains the the main data on refugees in Jordan. It'd be good to cross-check key indicators to validate your results and to identify potential discrepancies and explain them. Because this might be questioned at some point. Employment rate is one example. The VAF reports employment rate of 36% of refugees outside of camp and 24% in the camps, maybe coming from definitions and questions the way it's asked, but good to cross-check. Food insecurity, which is in our case using the WFP methodology, is also gives us higher results of food insecurity. I honestly have questions on assistance coverage that you find in the data that raises some questions. To put it into perspective, UNHCR World Bank cash assistance in the camp is blanket, right? We have a full coverage of of whole household living in the camp, and this does not reflect in the descriptive stats. And for UNHCR specifically, the highest coverage we ever reached out of camp is 23% of households. So much lower than what is reported by households. And we know, refugees have been interviewed for over a decade, that response can be skewed. So happy to have a separate discussion with you, Sarah, on this, to try to reconcile the definitions and the measurement approaches. Overall, you find exactly what we find, right? Surprisingly, we didn't find an increase in poverty, in consumption aggregates. We did find, however, concerning results when it comes to rising debt. So refugee households are extremely indebted, and this has increased. Worsening food insecurity, increasing child labor, and other negative coping mechanisms. So it does confirm what you find. When it comes to policy recommendations, so the recommendation on cash assistance, and the need to continue targeted cash assistance to support the most vulnerable is well taken. We fully agree with this, but we need to align, I think, policy recommendation with the reality and the funding realities on the ground, with decreasing support of the international community that continues and hits our possibility to provide cash assistance. When it comes to greater inclusion in social protection systems, here again, I think we need to align to the political context and the very difficult political signaling to Jordanians of inclusion, of any discussion around inclusion into the NAF. Having said so, I think we did a lot of work to align systems. So we have similar targeting. We look at similar amounts of disbursement per household. The debt, and this is my last point, Dr. Azaz, debt deserves a great attention, not only as welfare concern, but also because indebtedness may constrain households' ability to return to Syria. So I'll stop here, and over to you.
Thank you. Thank you so much, Margaret, for reflections that are very close to the field and reality and the nuances of the Syrian refugees stories. When I read the paper, as I think most of us, I was not shocked by the difference between Syrian refugees and Jordanians. The fact that these are communities that have left their assets back home, the fact that their social networks have been disrupted, the fact that a lot of them are, and when I was Minister of Education, there is a real trauma, especially among single family households with mothers, etc. So all of this gets reflected in the results. And yes, I mean, so the shocks would be absorbed differently by Jordanians than by Syrian refugees, and I would expect that, frankly. That the question becomes, what do we do to kind of introduce vulnerability? And where I was surprised, and I think Margarita's answers is that what you mentioned, that Syrian in camps are more vulnerable than Syrian outside camps. And that was a bit of a surprise to me. I would have thought that those who are in camps are less vulnerable because they benefit from all these different programs, and they're in the camp, so they can get access to. And that really begs the question of global governance issues, and maybe Marguerite, how is UNHCR dealing with the fact that Europe essentially has gone a little bit more conservative, especially towards migration and towards refugees? And can we find a win-win? Can we find the common good? Because I think we all agree that it's better for refugees to be close to their homes than in a different part of the world where they might not even speak the language. But that does impose costs on countries, receiving countries like Jordan, that aren't easy to fill the gap. So I guess my question on this one is, how would you now, what is it, like 10 years now since the Jordan Compact? Has there been an assessment of the Jordan Compact? Is there any appetite for the EU to tweak it and make it work going forward? Or is UNHCR, like other UN organizations, really struggling just to keep their head above the water in these conditions? Thank you.
Thanks, Your Excellency. Look, I think Jordan is a great example of a best practice, right? The Jordan Compact was designed to support Jordan as a host country. And in many ways, it did so, right? It enabled refugees to access basic services, it opened up the labor market, not as much as we would have liked to. Also, we need to understand the realities in Jordan and a high level of unemployment among Jordanian populations and so on. I mean, I think there were many assessments of the Jordan Compact. The implementation challenges are quite well documented. I think the trade agreement was a great idea, fell at the time where, COVID hit, where maybe the realities of engaging in companies and trading with the EU were not fully understood, how difficult it would be, how higher standards are required compared to the American trade agreement. And in a way that we didn't see as much positive impact as we should have, or as were expected. Nevertheless, I think look at the trends. When you look even in the paper, in this paper, right, you could see between 2016 and 2025, more refugees are able to work. We see improvement in the poverty quantiles, and these are potentially very much linked to the Jordan Compact and the tools that were deployed in Jordan to support the government. The Triple Win book was also able to show how inclusive policies have reduced the cost for the international community of supporting refugees, right? So this is positive. I mean, the camp setting remains a very much humanitarian setting, which costs a lot of money, right, and restricts households in many ways. But maybe to go back to your question, I think right now we are focusing on supporting sustainable voluntary return to Syria. This is the priority. This is the priority of the Jordanian government. This is what we see from our latest intention to return survey. In December 2025, 73% of refugees were still here, right? Intend to go back to Syria eventually. So and most of them in the next 5 years. Some of them in the next 12 years, which we're halfway through already. So we need to make sure that we can support refugees, that they don't face barriers to return. That is one of them, right? In the meantime, my last sentence, we need to focus on the achievements in terms of inclusion that Jordan managed, Jordan displayed for those who are not ready to return. So we will need to find ways to safeguard this quite inclusive protection environment in Jordan.
Excellent. Thank you very, very much. It is 5:54, so I think we need to move to session 9. The title is Syrian Refugees in Jordan, Demographics, Labor Market Outcomes, and Wellbeing through 2025. Speakers Caroline Kraft, University of Minnesota, and Abdulrazak Tamim, University of California. Welcome aboard, and 10 minutes, please.
Wonderful. I'll be presenting here. Let me just get full screen. All right, fabulous. Okay. So I'm presenting this work that I think very much complements the previous session, just looking a lot at the household, shocks and coping, and I'm going to be focusing on some individual level outcomes and a lot of progress that's been made on education and employment, some progress there as well, but also this challenge of deteriorating health. So this is work with Abdulrazak, who's at Berkeley as well. So we've been talking about the Jordan Labor Market Panel Survey here, and I just want to emphasize this point that was brought up previously is the survey in 2016 and 2025 was designed to oversample areas with a high percentage of non-Jordanians, including Syrian refugees, and to be nationally representative. So that's for camps and non-camp populations, for these different populations. So I'll be comparing Syrian refugees to Jordanians in some points, and also examining Syrian refugees' outcomes over time, because we have 2016 and 2025. And I'll tell you the storyline. The title gave it away in terms of the policy focus. We're seeing this great progress in terms of education. Enrollments are continuing to improve for the Syrian refugees. We're seeing some progress in the labor market, increases in employment rates, but also unemployment rates are rising as well. So it's a little bit of a more complex story there. And then in terms of health, there's been deteriorating access to the public healthcare system and unsurprisingly also worsening health over time, which is a very concerning area and should be key for policy focus going forward. So I'll start kind of with the education piece and the education policy, and then show you what's happened over time. So we already knew, even in 2016 with that data, that Jordan was a regional success story for supporting the education of Syrian refugees. There was early, particularly compared to some other countries, integration into the public school system, free basic, free secondary. And to make that happen, second shifts were used, which are not perfect, but helped get students into schools. Some school building is needed. And one of the consequences of this is that there were not negative effects on Jordanians' educational outcomes from the Syrians arriving, because this additional capacity was brought online in various ways. Now, although there, of course, I'm saying the success story, there were refugee barriers to enrollment, whether sort of documentation or economic challenges folks were facing, but families of the refugees, as well as the Ministry of Education, facilitated enrollment into the schools, and programs of policies that tried to address some of the drivers of dropout and non-enrollment have been important. It continues to be an issue, though, that students are dropping out, whether due to struggles in school or the pull of family, whether that's for boys trying to work for income for the family or other responsibilities, more so for girls. Those issues remain, but they can be countered by policy and programmatic supports. So we knew even in 2016 that Syrian refugee children had achieved educational enrollment similar to the levels they had when they were in Syria pre-conflict, when they were in Jordan. And what we can see with the 2025 updating this is a story of some further progress. So this figure is showing the educational enrollments of Syrian refugees by sex and age for 2016 and 2025. The solid lines are the totals, the dashed lines split male and female, and then the darker ones in black are 2025, gray is 2016. Now, I want to emphasize that there's still room for further progress. Syrian refugees enrollments remain below Jordanians at both 2016 and 2025, not shown on this graph. And as we were talking about earlier, there's an issue in the camps. Enrollments are higher in school and host communities than camps. Part of this might be a little bit of a selection of who stays in the camps, but that's a challenge to address. Yet there's this very positive story of we're seeing continuing increases in enrollments. There's slight delayed entry. If you look at that age 6, there's still a little bit of under enrollment at the youngest ages, but you've got near universal enrollment through ages 8 through 12. The declines are starting in the teen years, but that's later in the teens than happened in 2016. We're seeing more persistence through ages 13 through 19 in 2025 than we did previously, and a little bit of more higher education enrollment, particularly for girls. And there are only small or mixed gender disparities. It depends on which age group you're looking at, whether boys or girls enrollments are higher. So this is a story of a lot of rising school enrollment. In terms of the labor market, we were talking about this in the last session. Syrian refugees initially were not legally allowed to work, but the Jordan Compact created the refugee work permits in exchange for aid and trade concessions in 2016. Now, initially, there were pretty limited sectors. This has expanded some over time, changing what occupations are allowed for permits. Permits became a little more flexible. They're now the flexible permit option rather than just tied to one employer, which was initially the case. But there have also been changes in costs. So in 2025, the costs of permits were higher and they required the social insurance contributions. So there have been a lot of different changes in the permits that have had kind of complex effects. And so what we're seeing, though, is that there's not been universal uptake of the permits. Among employed Syrians, in 2016, 43% had a work permit. It's 47% in 2025. So because somewhat more folks are employed, this is a little bit of an expansion, but not a huge expansion and not universal by any means. Those with permits have them. We asked a lot about the reasons this time. So because it's legally required or their employer required it, mostly legal requirements, but sometimes employer. And then it's a little more heterogeneous for those who lack permits. We asked why. Sometimes they faced employer barriers. The employer wouldn't do the permit. Sometimes they thought the permit wasn't needed or that they were not eligible, and they had some concerns about costs and benefits. And we're seeing in terms of job quality too, although there are these permits, the Syrians continue to be predominantly in informal and irregular wage work in both time periods. So the job quality hasn't shifted much between 2016 and 2025. In terms of employment, unemployment, and labor force participation rates, here we're looking at all those rates. Labor force is a percentage of the population, as is employment, and unemployment is as a percentage of the labor force. So we're looking at these by sex for Syrian refugees over time. And we see a big increase in labor force participation from 23% back in 2016 to 39% in 2025. Employment rose, but not as much as labor force participation. It rose from 19% to 28%. And the unemployment rate almost doubled from 18% to 30%. These trends are paralleled among men who, of course, have higher rates of all these rates. Women's participation and employment increased, but remain pretty low. Only 8% of women who are Syrian refugees are employed in 2025. So lower still for both groups than Jordanians, but a lot of progress has been made. So in terms of the area where I think a lot more work is needed is in terms of health policy. So healthcare has become increasingly expensive for Syrian refugees. Initially, they could access public health systems care for free. In 2015, they had the same prices and insurance criteria as Jordanians, so they're often paying the uninsured Jordanian rate. And then in 2018, higher prices as foreigners at public health facilities. I'll note there continue to be exceptions for maternity and childhood services, which is very important, but this is becoming increasingly expensive for the Syrian refugees. And we see how this plays out in terms of accessing healthcare. So this graph is showing the healthcare source, the percentage with different sources for Jordanians and Syrian refugees in 2016 and 2025. And one thing that's not shown on the graph is the health outcomes. We show in our working paper, Syrian refugees have poorer health than Jordanians, and it worsened to a greater extent from 2016 to 2025. This is a population that has no health insurance most of the time, and more than 3/4 have no health insurance, and there's been little change there. So Syrians, if you compare the Syrians and Jordanians, are relying much more heavily on private care. Jordanians 73% in 2016, 82% in 2025 are going to the public hospital or clinic for their main care. So they're getting expanding public care access for the Jordanians, but the Syrians have a much more complex network of care. The percentage going to public hospitals or clinics dropped from 44% in 2016 to 32% in 2025. They're much more reliant on international organization or NGO care in 2025, which has financial challenges, funding challenges. So, in
Caroline, we're going to have, I see you get
conclusions. I'm concluding. I'll finish up. Okay, so conclusions. So we've seen this improvement in school enrollment with a supportive policy environment and efforts from government and NGOs. Still, there's some struggles in school and with school success. In terms of what's politically feasible, I would say efforts to improve school quality, which Jordan is working on, things like teaching at the right level, may particularly benefit refugees while benefiting Jordanians as well, and thus being a good investment in terms of political feasibility, while still continuing to improve enrollment. In terms of promoting decent work, we see some progress in labor market inclusion, but half of refugees lack permits. Costs and benefits of permits are an issue. Restoring fee waivers would be a loss of revenue, but encouraging decent work can benefit the economy. So there may be some trade-offs there and opportunities, as we were talking about in the last session, for international support. And increasing access to healthcare, I think it's a real priority. The costs of inaction, lost life, and human capital are substantial. I'd recommend restoring access to healthcare at the same cost as uninsured Jordanians, but this does require donor or government spending, so finding that fiscal space is very challenging. So I'll stop here and look forward to the discussion.
Thank you very much, Caroline. Very interesting. Lots of questions. Let me turn to Leonardo Mancini, Chief Social Policy and Social Protection at UNICEF. Jordan, for 10-minute reflection.
Thank you, Dr. Homer, and thank you for ERF for inviting me to act as a discussant of this paper, and congratulations to ERF and Department of Statistics for this for completing this big task, and congratulations also for the authors of the different papers that are contributing, are now in the public domain, and will contribute to the discussion, to the policy discussion, including on the issues of the refugees and their inclusion in national systems, which is a matter of primary importance and also part of the current policy debate. You know, the last two papers are very much connected, and so it's also interesting to see them in the perspective. For example, I found very interesting in the previous paper the discussion about the concentration of Syrian refugees in the lowest wealth quintiles, that can help also to understand better the health status, the education status, and other aspects related to the social condition of refugees. So the survey is important because it complements other data sources available in the country to better understand the situation of Syrian refugees, the evolution over time, but also we know that this is a reality that is changing very quickly in terms of demography, labor market, and so on. So there is a population change with the returns, but also the issue related to the labor market and the evolution of regulation in the current discussion. So we are at a point, but things are changing. But still, this evidence is important. I heard Marguerite talking about the discrepancy between the results of the survey and those collected through the labor market panel survey, and there are potential explanations, including the fact that this survey is inclusive also of refugees who are not registered. So that's another aspect that it will be interesting also to better understand what is the reality of those who are not registered with UNHCR, not only those who are registered. At the same time, we are waiting also for the census that yesterday was mentioned by Dr. Haider, and this will be complemented. So while the contradiction may be a matter of concern, I see all this body of analysis complementary and important to look at them together to better understand and to see what are the implications for policies. One point that was not presented by Caroline, but it's in the paper, is also the demographic transformation. The survey, for example, confirms that the demography of Syrian refugees is changing, not really in the population structure, which is quite natural because this is a truncated population that is entering another country, so it's aging by default, but because some of the characteristics like fertility is changing quite dramatically, and this is confirmed what was found by the DHS 2 years ago. And early marriage, child marriage, which was also a coping strategy to face, how to say, the challenges of, of the refugees, is now reduced to much lower levels. So that's another important factor to discuss, which has also implication on health. And in general, I think that the demographic transformation is another thing that has to be taken into consideration in the discussion. It's an important result of the work done by Caroline and colleagues. Education, of course, it's a real progress, and the paper is right to highlight that. And because over the years, over the two rounds of the panel, the increase in enrollment in basic and secondary education is something very important, of course, and we saw also for Jordanians the early childhood education is far from being something achievable at this point. What is a matter of concern is that especially boys after the 12th grade start to drop out of school. And we can see what are the reasons of that, which is, the lack of interest, especially in the host community, but also the cost and the transportation. So other elements that are constraining that. And for that, there is room for policy. And we see that transportation is not only an issue related to, to strengthen the labor market participation of women, but it's also something very important to allow the access to social services to vulnerable populations. The main issues to discuss, and that has been put in the recommendation by Caroline, is the quality of education. And this is not something that concern only the Syrian refugees. Enrollment in basic education and upper secondary education increased substantially in Jordan, including for refugees. The main point is that children are going to school and are not learning. So the learning crisis is something that goes beyond the refugee reality. But for the refugees, it's probably more severe because they are belonging for the lowest socioeconomic status in the population. So there are those at risk of not accessing complementary support. And this confirms the data from international comparative studies like PISA or TEAMS or PIRLS, where there is not a precise disaggregation by refugees. So I think the complementary work and some work to be done probably in in conjunction to understand also the more the dynamic of learning across the lowest affluent part of the society and the refugees. What I found particularly important and policy relevant in the discussion on the labor market is the observation that there is no competition between the Syrian refugees and the Jordanians, while it's found that the competition may exist with other migrants like Egyptians. And I think it's important to reflect that, especially in the discussion that is currently happening on the freezing measure for work permit for foreigners that was approved on the 1st of June this year. So this is a relevant issue and it deserves discussion. Of course, what happened in the last years with the change in the measures to support registration and access to social security is important. It has a cost. It also reflects the reduction in donor support, especially the end of programs that demonstrated to have also impact, like Sidama Plus Plus, which was led by ILO with the support of different donors. And now we see the limitation. At the same time, the design of these measures should try to understand better the acceptability and their understanding from the refugees on the importance of being in the formal sector and receive social assistance. At the same time, we know that one of the major barriers is the fact that the employers cannot bear the cost. So the cost is high and the perceived benefit from the refugees is low. But again, the findings and the analysis and the reflection in the paper may help also to understand and to enter into the policy debate concerning the recent measures that the government is having, and if these measures are compatible with, are effective to reach the major policy objectives that the government want to achieve as part of the economic modernization vision. The part on health is also another important element, and what I found interesting is the change that occurred over time in the perceived health, and I think it will deserve further analysis and attention. First of all, there is not only a deterioration of health over time, but there is also a re-ranking. It's quite particular, and it should be explained better how the Syrian refugees' health in 2016 was ranked better than the one of the Jordanians. So it's something that we know the limitation of this self-assessment and also the fact that the reference can be different. And also it's important to do an analysis by socioeconomic status. So I think the work has to be more nuanced to understand better the dynamics, but of course what occurred over time in terms of access to health and the cost of health explain this, at least the dynamic over time. And also other studies are showing this type of, how to say, deterioration in the health conditions. I don't know if I am out of time, but I have other.
Yes.
Okay, no, I think these are my
30 seconds.
Yes, my main message is I think there is also the part concerning the returns, the intention for returns, and again, it's something that has to be read in conjunction with other exercises that are being done under the leadership of UNHCR. It's all interesting, and as I said, I find this work a complement of other evidence which is being generated, and it's important in a phase where the support to the humanitarian response in Jordan and to Syria is going down. So it's important to get all the relevant information, try to find the best policy and the best mobilization of funds to protect the most vulnerable.
Thank you, Leonardo, and thanks again, Caroline. This is another very thought-provoking paper and comments. I keep thinking of the policy implications of all of this. So on education, let's distinguish between issues that are common to Jordanians and Syrians, like the learning crisis. Now, there might be a difference, but it is an issue in both, and therefore it requires its own structure. And education issues that are purely related to Syrians. And I remember when I was Minister of Education, we were surprised when from the top authority in the country, when everybody was told there should be no children left out of school in Jordan, and therefore a directive to kind of take on all the Syrian children. We expected a huge flow of children, and that didn't happen at the beginning. And that's when I'm sure you all know what Makani is, this support program that helped children to sort of bridge the gap, the education gap, but also a lot of the psychosocial and other trauma that they had gone through. And I'm fascinated. I've been fascinated by that because it really made a huge difference in switching the story. If in any future, either sort of studies, etc., we can ask students if they had been through Makani and how that has reflected through various issues. Second, so this first question on the education, the second one on permits, from a policy again perspective, has anybody produced a study that would be helpful to Jordanian policymakers that would show the pros and cons of the Syrians being in the formal sector with permits without raising the cost of that, and the informal sector, which is, what are the implications of both for the labor market in Jordan? And wouldn't Jordan be better off with a formalized Syrian without punishing them with higher rates? And the third one is on healthcare. I remember very clearly that this was sort of supposed to be going back to the Jordan Compact, that the donors were supposed to cover the running cost, if you will, of the but we've seen that the quality has deteriorated and the gap that was there. And last but not least, and this applies to all the papers we have seen, public transport and the lack thereof. The one thing I kind of again from a policy perspective, I would love to see what all of this, everything we've been discussing for the past 2, 3 hours, how it can be reflected with a better public transport system. What's missing and what can be done? Thanks. Please
Yes, I can start with the last part because transportation is often neglected aspect, but is an enabler to, how to say, to reach services and to reach work. So it's something important that we have to stress. And we see sometimes also as international agencies, we are struggling to find the money for that. As part of Makani, which is a program under my section, I will be chief of social policy for the next month. Then I will move to Syria soon. But we were providing transportation is a key element, and we see that when there were reduction in the funding, we have to cut, and we see that the most vulnerable children are at risk not to reach the services. And so it's something important, and it has to be put in the discussion on social protection all across the board. Makani, yes, it's approved model that enable children from disadvantaged backgrounds, including refugees. Currently, more than 1/3 of children attending Makani is a Syrian refugee, to have the care and the attention for their learning, for their skills, but also for child protection. So these are models. So not all the learning occur in school. There is an environment where you can take care of the children in a way that they can grow. And we see the difference between those attending Makani and those not attending. So there was a longitudinal study done by ODI under the GAGE program that shows this type of impacts. The good news is that there is an intention of the government of Jordan to institutionalize Makani, and the government of Germany provided 20 million euros to support the institutionalization. Then the main challenge will be how to make it sustainable after the end of the German funds in 4 years' time, 4 or 6 years' time. But the government of Jordan recognizes the role of such program in enhancing human capital and the protection of children. On the work permits, I think it's something in the national debate, and ILO actually produced a lot of evidence in the last years also to see what are the barriers and what are the risks and of course, I think there are many advantages on formalization of the economy, also in terms of tax returns. So the government can take money, but this is something that needs to be probably. It's true. We will need to create more evidence to show that formalization have other benefits. It's not only the protection of the work, but many other issues. It's not a cost, but it has positive spillover, and it has been demonstrated elsewhere. The problem is that it's associated also with taxation, with other elements, and we know it's a hard issue to discuss and to debate. While for the health, of course, the change in the policy and the increased costs that refugees have to face to access to services affected the behavior and the reliance on, the increase of how to say attendance of services that cost less, and probably this is also reflected in the perception of health. There were models like the one in Turkey that was considered as a strong model of inclusion of refugees in the primary health care, but this depended largely from donor support. And again, it's the donor support that provide this, how to say, that allow that. And we understand that countries with limited fiscal space may suffer, and Jordan is one of them. So as it's happening, and probably the focus should be on primary health care, on specific categories at this stage, but it's a big matter. And of course, it's important that the donor community don't withdraw from that. And I think there are responsibilities and commitments that need to be put up front with the donors, and the health and the social protection are the major ones.
Thank you. Thank you, Leonardo. Very valuable comments. And yes, I salute you for leading McCanny, and I'm delighted that I did not know that it had gotten so much more, another flow of blood in its veins. Thank you very much. With that, we're finishing session 9, and we're moving to an open discussion. Ideally, it would have been for about 10 minutes. Maybe it's going to be, we'll see if we can get a few more minutes from the last session. But let's open it up. And yes, my preference is to raise hands because that's what I see rather than on the chat. I'll try to look at the chat. But if we're at the point where we are saying, what does this all tell us about women, households, refugees, vulnerabilities? How do we, what is new evidence or of things that need to be reflected in policymaking? And what are things we need to undo, basically, because evidence suggests that it doesn't work? There are no comments. We can move. It's almost time to move to the last session with Ragi and Yasmin. Okay. So we should do that. Ragi, are you with us?
Yes, I'm here.
And Yasmin, closing remarks. You're the father of all of this, Ragi.
Thank you so much. Well, I've really enjoyed the last 2 days very much, and hearing and seeing the fruition of this work after all this time. So I'm going to try to kind of provide some synthetic remarks linking the discussion from both days, and hopefully that will elicit a few comments from the chair afterwards. So we'll see. So we have seen that Jordan is definitely facing a demographic window of opportunity. There are declining demographic pressures, both in the form of the fertility rates are going down, and there is also a slowdown in the working age population, partly driven by refugee return and reduction in refugee influx, but definitely some return. So the question is, how can Jordan capitalize on this demographic window by trying to get a demographic dividend? And really depends on trying to turn this youthful population, this working age population, into producers. And that means substantially increasing labor demand and increasing labor force participation, specifically women's participation, but also men's, which tends to be lower in Jordan than elsewhere in the world. So, and there's some, discussion that was prior, 10 days prior in the ERF annual conference, showing that labor demand is improving. There is private sector employment growth is growing fairly rapidly at 4% per annum during that 2016-2025 period. And the quality of jobs in the private sector is improving. And we see greater formalization, and that has affected other dimensions of job quality. So there is definitely positive progress on that count. However, there are, and I should say also that we've seen that emerging sectors in the private sector, like ICT and the green sector, have been growing more rapidly than average. And the ICT in particular has been providing better jobs than average and more jobs for women than average. And so I think that the green sector has also been growing faster, producing more jobs for women, proportionately speaking, but the quality of these jobs still may need a little bit of help to make them decent jobs. So there the signs of hope. Now there are clearly groups that are excluded, and I'll start with youth. We've seen that there's still a protracted and increasingly uncertain school to work transitions, very high unemployment rates among youth. And there is this need for policy to facilitate this entry into the labor market through work-based learning, internships, on-the-job training, apprenticeships, and possibly subsidized. There's some role for subsidies to help this insertion of youth into the labor market and have a strong role for the private sector in this skill development and however, the biggest barriers we've seen are for women. And while private sector employment has been growing at 4% per annum, it hasn't been growing that fast for women. It's almost half that growth for women. And there are conditions in the private sector that has made it really difficult for Jordanian women to join the private sector. First, there is this very long work day with increasingly long work hours over time. And that is a huge barrier for women, given what we've seen is the conflict between unpaid care work responsibilities and the ability to dedicate time for the labor market. And that is not a coincidence. The fact that the workday is long and getting longer is due to policy. It's due to the architecture of work in the private sector. In fact, that most of the costs to employers are fixed on a monthly basis rather than an hourly basis. And with fixed cost of employment, the incentive for employer is to lengthen the workday to intensify employment rather than to hire more workers. And that is the minimum wage is denominated on a monthly basis, social insurance contributions that are denominated on a monthly basis. So we're talking about flexible employment arrangements, but these are an add-on. In fact, we need to flexibilize employment overall by making the cost of employment more variable and therefore giving more incentive for part-time work, flexible work, shorter work hours. At the moment, the incentives are all going in the wrong direction. And so that's one big constraint for women is the architecture of employment policies in the private sector and that are not really compatible at all with women's social reproduction roles. Now, what about self-employment? Self-employment is an option for women who want flexible work and who need that greater flexibility. However, it is still at very low rates. And there are lots of barriers that we've seen for women's self-employment. There is digital inclusion as a problem. There is a missing middle between microfinance and SME loans. There is a lot of issues with formalization of self-employment. So a lot of still problems with trying to create an entrepreneurship policy that can push self-employment as an option for women. Now, we have seen that there are, of course, all kinds of issues related to access to work and transportation policies, financial inclusion, that are all could be dealt with to increase women's access. Childcare is an issue, but it's on its own, it's not going to be a solution to resolve all of these barriers that women face, and it has to be done within a more comprehensive set of policies to support women in the labor market. Now, finally, we discussed issues of inclusion of refugees and how refugees are doing, and clearly there's much, there are progress on the schooling side, maybe on the quantity dimension, and we have question marks on the quality dimension. There is progress on labor markets. They are working at higher rates. They're participating at higher rates. And maybe the desire to work among refugees is exceeding the ability to get jobs. So unemployment rates are rising, but I find unemployment rates a good sign of this desire to work and to seek employment. So it's not always a bad sign. I would also say that the opportunity for refugees to return is there, and there's going to be a lot of selection. So those who return are not necessarily the same characteristics as those who stay. Probably those who stay are more vulnerable. And exactly that's the selection we see for those who remain in camps versus outside of camps. So we have to be aware of these selection issues when we look at trends among refugees, and maybe the health trends are indicating that. So I will stop here. I think that we have had a very rich discussion. I want to invite you all to keep asking this data to give, because there is a lot more in this data than we've been able to cover in the past in all this analysis that we've done so far. The data is publicly available. I've counted over 100 academic journal articles from the previous versions of the Jordan Labor Market Panel Survey. I think it's a very high fraction of scholarly work on Jordan in these human development labor market issues, and I expect that to continue. So I'm encouraging all researchers out there to really continue making use of that data to produce very valuable knowledge to help Jordan. Thank you.
Thank you so much, Ragi, and thank you for everything you have done in the past to keep these issues alive. Let's turn to Yasmin Fahim. Good to see you. Director of Research and Programs and the ERF. Yasmin, the floor is yours, and please.
Thank you very much, Your Excellency, for stellar moderation of the day. As we come to a close of these 2 days, I have to admit that this is a bittersweet moment. On one hand, it's immensely rewarding to see the culmination of a journey that has brought researchers, policymakers, development practitioners, and our partners together. But on the other hand, this also marks the conclusion of a chapter that many of us have been working on for a few years now. The journey began back in 2023 when we started mobilizing resources, building partnerships that made this survey possible. It continued through countless discussions with our partners, technical preparations, questionnaire design, field implementation, data cleaning, the analysis. Most importantly, it was built on the close collaboration between the Economic Research Forum and the Jordanian Department of Statistics. And this effort was spearheaded by Ustaza Jihan El-Qaryuti, the survey manager from DOS, and whose commitment and professionalism made the successful implementation of the 2025 round possible. Since then, we have celebrated several milestones: the completion of the fieldwork, the public release of the data, training workshops, and the production of this very rich set of analytical papers. And finally, these dissemination webinars, where we have had the opportunity to reflect on what the evidence tells us about employment, gender, youth, entrepreneurship, social protection, resilience, and the lives of refugees and Jordanians. For those of us who have been involved from the very beginning, seeing this entire process come together is incredibly satisfying. But while this project may be coming to an end, the value of the JLMPS certainly is not. The data set will continue to serve researchers, students, policymakers, development partners for years. We hope today's discussions inspire new research questions and strengthen evidence-based policymaking. I would like to extend our sincere appreciation to all those who made this possible, to our partners at the Department of Statistics and their outstanding collaboration, to Professor Ragi and Carolyn, the PI team, for their scientific leadership, to our authors and discussants for sharing their insights over those 2 days, to our moderators for guiding the discussion so effectively, and to our development partners whose support made both the survey and this dissemination event possible, namely the International Labour Office, the World Bank, the UNICEF, the IGC, International Growth Center, and UN Women, and specifically for the webinar and dissemination efforts, the IDRC. And to everyone who joined us over these 2 days, of course, we really appreciate your contribution. Thank you for being part of this journey, and we look forward to seeing how the JLMPS continues to inform research and policy in Jordan for years to come. I wish you all a pleasant evening and see you in our next event. Thank you very much. Over to you.
Thank you so much, Yasmin. And I've been out of the loop a little bit in terms of local politics in Jordan, and I'm a bit surprised by this. I shouldn't be, but I would love to hear more about it and ways where, of course, things can come to an end at some times, but we need to make sure that the wealth of information, the wealth of data, and all the policy implications papers that have relied on this are somehow captured. And as we know, the problem isn't over. So, and let alone what the next decade that we're entering with job markets and AI and what that's gonna do for skilled and unskilled and types of jobs, etc. So there is a lot that remains to be done, and we all, I think, are responsible to brainstorm and try our best to keep that work going. I've really learned a lot over the last 2 days, and I really want to thank ERF and DOS and each one of you who's been a participant, a researcher, and people who've watched this and took notes and affected the way they think about labor markets in Jordan and the various issues related to that. So from RISE perspective, and thank you for inviting me to chair this session. It was a lot of fun today.